our abstract is based on a protocol called the MI-ONCOSEQ study, which has been going on at the University of Michigan since 2011. So far, we've analyzed the data up through 2018, which included a little over 1,000 patients. And really, the protocol was designed to do next generation sequencing analysis in a comprehensive way, and sequence both the tumor and the normal genome so that we have the opportunity to identify somatic variants that, were potentially druggable and could result in, perhaps offering the patient a clinical trial that was therapeutically relevant. But because we were sequencing the matched tumor normal, we also had this overarching interest in whether or not we would identify pathogenic germline variants that were of importance. And I think to our surprise, although now has also been seen by many other studies, is that there's a very high incidence of pathogenic germline variants that are seen in patients who otherwise had not previously been referred for genetic testing or genetic counseling. And we had a particular interest in the MI-ONCOSEQ study in trying to figure out, what proportion of these germline variants were already known prior to the patient coming to sequencing, because I think that was a good indicator of whether or not the patient would have otherwise met clinical criteria for genetic testing. Like, did they have a very strong family history? Did they have a cancer type that raised our suspicions for genetic predisposition? And over 90% of the germline variants that were found in our study were novel, meaning we had no idea that the patient had them prior to study enrollment, which suggests that our clinical criteria for identifying people that may have a genetic risk for cancer may not be capturing all of the patients that are indeed at risk. And then what we also did was we tried to separate out, of the variants that we found, what proportion of them were sort of in these highly penetrant, genes that have a significant increased risk of cancer versus other ones where there may not be as much known about them and we're still, learning what their contribution is. And I think, we did indeed find ones that were very highly penetrant and therapeutically relevant in situations where we did not expect it. So these are genes that are well described, like BRCA1, BRCA2, PALB2, ATM, and the Lynch syndrome associated genes. And we found those in a fair number of rare cancers as well that aren't often referred for genetic testing. And these cancer types for which there's not a lot of sequencing data available to really understand what is the likelihood that a patient with that type of cancer would have a genetic predisposition to cancer. So I think that, we learned that they are there, albeit they're rare. And when you do find them, they can be of, I think, tremendous value for patients and their family members, because if there is a therapeutic target, patients may be candidates for things like PARP inhibitor therapy or immune checkpoint inhibitor therapy. And again, although it was a small number of patients that we treated on the basis of a pathogenic germline variant, we saw a few that had profound clinical benefit from treatment with either PARP inhibitor and particularly immune checkpoint inhibitor therapy, including one patient who had stage 4 cancer of unknown primary origin, who received an immune checkpoint inhibitor therapy, had a complete response, and actually at the time of our analysis, over 2 years later, remains free of disease. So that's a pretty remarkable result, and obviously very meaningful that germline variant was identified. So, I think that we're probably going to see more and more patients undergoing germline testing for inherited cancer predisposition. And, that may be in combination with tumor testing as well, so that we can try and identify all relevant therapeutic targets in one assay. But I think it will also result in just increased germline testing in general. And I think we're constantly revising our criteria. Oftentimes that's, by disease subtype, because I think there are certain criteria that are more relevant for certain diseases as opposed to others. But I think that more and more patients are going to be tested, and our results would suggest that although these therapeutically relevant pathogenic germline variants may be rare, they are quite clinically meaningful if they are identified, and I think therefore worthwhile looking for.